So my name is Lynn Hunt. I'm an occupational therapist here at the Rehabilitation Center. I've been here since 1980. Actually, 1980 we were at the old site at the Royal Ottawa Hospital. We moved here in April of 1981. So I've been here. This is my first and only job.
Wow.
Yes.
That's incredible.
Yep. Yep.
I need you to tell me again, but I
Okay.
need you to tell me just to make it easier for him to
Yeah. Yeah.
shorter on
Yeah.
here.
Yeah.
But that's kind of cool. So I like that I know that.
Okay. So my name is Lynn Hunt. I'm an occupational therapist at the Rehabilitation Center, and I've worked here since 1980.
Perfect. All right. So let's talk a little bit about why this is the best job you have, especially because it's your only job.
Yeah,
I love that.
I can't compare it to anything else.
Why would you go anywhere else?
That's
though?
exactly.
I love it.
Yeah.
So then let's talk about your team. So you were telling me that you really love working with your team.
Mm-hmm.
So maybe tell me a little bit about why you like working with your team.
So I do really like working with the team here. I work with people like the security officer here who needs to keep the parking location free so that the driving instructor can park his car there. I work with occupational therapists who may have to help somebody adjust their seating so that they're sitting in their wheelchair properly, so then we can use that for driving. I work with rehabilitation engineering who may modify some of the commercially available hand controls or spinner knobs so that our clients with the specific needs are able to drive. I work with psychologists who help clients when they're told that they're unsafe to drive, how they can deal with that if they're having a very hard time with it.
So how do you find that teamwork impacts your work? How do you find that it plays into what you do every day?
Well, I know that I have support if I need it from the various team members, but I also know that then the client will have that support also if they need it.
That's great. That's a really nice environment.
Yeah. So it's very different than working in private practice where you wouldn't necessarily have that support.
Perfect. Yeah, it's kind of a special thing at TOH or maybe in hospitals.
Mm-hmm.
So let's talk a little bit about what you do every day then, like how you feel that what you do gets to make a really special difference in somebody's life.
So I work, I'm not only an occupational therapist, but I've specialized in the area of driver rehabilitation. And so I see clients that have medical conditions that may either affect their physical abilities or their cognitive abilities to determine if they are safe to drive and what equipment they may need to drive. So I see clients that are new drivers, so they never have driven, and they may have cerebral palsy or a condition that affected them prior to turning 16, and they're now wanting to drive. Or I see clients who have been drivers and they now have a medical condition. They may have had an accident and now have an amputation. They may have a diagnosis like multiple sclerosis. And the question is, can they continue to drive safely? And what equipment they may need for that. And then I also see older drivers who have Parkinson's, dementia, those types of diagnoses, and the question is, can they continue to drive safely?
So then when you're working with all of those different kinds of clients or patients, what do you find is really satisfying about working with those kinds of people?
Well, certainly the drivers that we get back to driving after they may have been off the road for a couple of months or maybe a couple of years, and driving is one of the activities that they did in the past, and they may have been here at the rehab center and they've learned to do things like getting dressed or getting washed, making meals now with maybe only having one arm. And driving is usually one of the last things that they are looking at doing, and it then makes them independent. They can do things like taking their children to school. They can go to Tim Hortons and have coffee with their buddies without having to ask friends to drive them or family to drive them.
Okay, so I kind of like where you're going with that. And I'll get you to rephrase it a little bit.
Okay.
So then I really love that point about your work really helps to make patients more independent. So you really see that tangible difference in their lives. So maybe we can phrase it as, I love what I do here because, and we can go into that.
Okay.
Would that be all right?
Yeah.
Okay, so why would you do that?
So I love what I do here because I work with clients who maybe have driven before and they haven't been able to drive for a while due to their medical condition, and now we get them back on the road driving, and it's quite exciting because now they're independent, so they can do things that they want to do when they want to do them. So they can take their children to school, they can go to Tim Hortons with friends anytime they want, they can go to the local hardware store easily. So they're independent, and that's very important to people.
Do you find it really satisfying that you get to see the progression like that?
Oh yes, because often they've had to deal with things like now getting around in a wheelchair or preparing a meal with only one arm, and so now we've seen them do all these various steps, and driving is usually the last thing, and they find that makes them independent.
Mm-hmm.
And they also often say they now feel normal because when they're in a car driving, they look just like anybody else. And so they like that feeling. Normal's not the right word, I know, but that's often what they will say.
Okay.
Yeah.
Okay. Yeah, I'm just trying to think of how we can phrase that.
Yeah.
Yeah, I like that point about getting.
So it's exciting to see people get back to doing the things that they have done in the past. So they're now doing things that they may be doing in a different way. They're now, their mobility is by using a wheelchair, or they may be wearing a prosthesis and walking with crutches. So we teach them to do things like preparing meals in the kitchen while using crutches or a walker. And then driving is one of those activities that they did in the past that they need to get back to doing. And it makes them feel that they are now doing all of the things that they had done prior to either their illness or their accident or their disability.
Mm-hmm. And how does that feel for you when you get to see that?
Oh, it's very exciting. It's very rewarding to see them drive away with their vehicle that's now equipped with hand controls and adaptive driving equipment, and they're independent. They can do what they want to do.
What would you say is the best part of your job?
The best part of my job is actually working with clients that are new drivers, so people that have never driven before, and they want to be like all of their other friends. They turn 16 and they want to drive just like everyone else. And so it's quite exciting to start with an evaluation and then work through driving lessons and then find them safe to drive at the end and drive away with their van.
That's awesome.
Yeah.
So you're saying you had a patient story you wanted to tell?
Yeah, so I have a client who's in his 20s. He had a spinal cord tumor around the time of birth, and so he had never driven before. He had always used a wheelchair for mobility, a power wheelchair, and he was going to Carleton University, doing everything else as all of his friends, but he wasn't driving yet. And he really wanted to drive, so we taught him how to drive with hand controls. We also helped him choose a vehicle, a van, that he could get in and out of while in his power wheelchair. But the exciting and different part about him was his girlfriend is also in a power wheelchair. So we had to make sure that the van accommodated her in her wheelchair in the front passenger position. And I have a really good picture of the two of them with big smiles. And one of the things that they did after he got his permit that allowed him to drive independently, which was his G2 permit, they actually went to Toronto and had a weekend away where they have been living with their parents. So this was their first time away on their own, and it was all because he was now able to drive.
How does that make you feel when you get to see that?
Oh, very, very exciting, and yes, it's very rewarding. I feel like I've made a difference in somebody's life. Yeah.
That's such a great story.
Yeah. Yeah.
That's so nice to see that really tangible difference.
Yes.
You never would have been able to do that.
That's yes, yeah.
I imagine that's a lot of your clients. You kind of get to see that.
Yes, yes, yeah. There are clients, unfortunately, that I will have to tell them that they are unsafe to drive, and that's never an easy thing, even after all of these years. It's not easy to tell someone that they are unsafe to drive. But I know for their safety and the public's safety, it's best that they not drive. And then I work with them and focus in on now how are they going to get around, because we know it's still important for them to get out and do things, but we need to think about how they're going to do that, whether they have family or friends drive them. And I encourage them to ask family and friends for transportation. People are often hesitant to do that, but I give them permission to do that. I often talk to the family and explain to them the importance of getting around and doing things, and that their family member will need transportation. So I try to make it a bad situation as good as we can make it.
For sure. All right, I think we're all set.
Excellent.
See, not too painful.
No,
Yeah.
no.
Oh. That's for
I mean, you can even show me how. I can go over here so you have something to look at it, and you can tell me again. Alright, I'm just gonna go across your shot. Sorry.
Yep.
Tell me again how it works.
Okay.
Where the gas and the brake and stuff are.
So this is the hand control. So you push forward. Oh, okay.
okay.
So you push forward to operate the brake, and just rock, we call it. With this type of hand control, you just rock, and that operates the gas pedal. Okay. And for steering, they use a spinner knob.
Yeah, let's do it all.
Okay. So you push forward for the brake, and rotate or rock down, and that operates the gas pedal. They steer, because they're steering with one hand, they use a spinner knob, and they just keep their hand on the spinner knob and make the turn just like this. We teach them how to operate the turn signal lever while they keep their hand on the hand control. Some people have the wiper. I am too in the vans all the time.